for joining us today for our second webinar on the Many Phases of Public Health webinar series, co-sponsored by the American Dental Education Association and the United States Public Health Service. My name is Carolyn Booker. I am the Senior Vice President for Educational Pathways here at ADEA. Today's webinar features our expert panelist, Mr. Paul Gerard, who is the ADEA Senior Advisor for Student Financial Services. Paul has over 35 years of experience helping students responsibly repay their loans. Paul today will provide important information about the Public Service Loan Forgiveness Program. We're going to talk about benefits, eligibility requirements, challenges for you to consider whether or not the PSLF is a program for you, a career in public health, and what just might be the best fit for you. Before we get started, there are just a couple of housekeeping items. As a reminder, all attendees are in listen-only mode. The webinar is being recorded and will be available in the next few days on ADEA Go Dental website. Please ask questions. Paul is always eager to answer your questions and share information with you. Please use the question and answer box to send your questions. At the end of our discussion, Paul will go through as many questions as we can based upon the time we have available. So, let's get started and learn as much as we can about public service loan forgiveness. So, Paul, tell us about the program. Information like what it is, how it works, why was it established, etc.
Thank you very much, Dr. Booker. Hi, everybody. We're just delighted that you're joining us, whether you're considering dental school or currently enrolled dental hygiene or dental student. We're delighted that you're part of this program. The Public Service Loan Forgiveness Program, a lot of folks have made it to be a complicated program. It's really not. We're going to try to simplify it for you. It was passed into law 12 years ago in 2007. And although I was not sitting at the table when they came up with the program is designed to encourage borrowers and graduates of any degree program, any discipline, to enter and remain in the public nonprofit sector for at least 10 years with the promise to forgive any remaining federal student loan debt after that 10-year period of time, absolutely tax-free. That's one of the big benefits of the program, that the debt that's forgiven after the 10-year period of time, you do not have to claim it as taxable income. Clearly, when I said I wasn't at the table when they were coming up with the program, the intention of the program, it's very clear, is to, Dr. Booker, as you know, incentivize borrowers to go into the public nonprofit sector where the theory is they're likely not going to make as much money as they might in the private sector, but for the good of the country and society, by working in the nonprofit sector, the federal government will forgive their debt after 10 years. And again, it's extremely important to know that this program is not degree specific. Certainly dental students and dental hygiene students can qualify for public service loan forgiveness.
Great. So tell me again, so exactly how does one qualify for PSLF? Is it difficult? What about dental school, dental hygiene, graduates? Who all are the kind of individuals we think can qualify for this program?
Great. So let's look at this. There are 3 requirements you have to meet in order to qualify to have your debt forgiven under the Public Service Loan Forgiveness Program. And folks, this is something that's extremely important. The 3 things you're looking at, always remember they have to be happening at the same time. I tend to think of PSLF as a clock that has to tick 120 times, or a timer that has to go 120 times. And it doesn't move unless all 3 of these things are happening at the same time. Number 1, you have to make 120 timely scheduled payments with an eligible plan. Let's stop and look at that for just a moment. When you hear this program referred to as a 10-year program, that assumes the 120 payments are consecutive, but they don't have to be. But it's 120 payments with an eligible plan. What is an eligible plan? An eligible plan is an income-driven repayment plan. Some of you guys have heard of these. Income-based repayment, which is a much older plan, pay-as-you-earn, known as pay, or revised pay-as-you-earn, known as repay. And the theory there is simply that after 10 years, if you're using one of those programs, the question is not going to be, Dr. Booker, do you still owe debt? the question is going to be, how much debt do you owe? So number one, 120 timely scheduled payments with an income plan. Number two, those payments with an income plan have to be made on loans that the federal government made, called direct loans. The government can't forgive debt loans that they did not make. That's one reason private loans are not eligible. A private loan did not come from the federal government. Now, here's where it really gets interesting. In the 2010-11 academic year, that's about 8 years ago, the federal government, who had been making loans for a long period of time, they took over all of the federal lending. So as a dental student now, or a dental hygiene student now, if you're borrowing federal money, look at the name of your loan, and it will say direct subsidized Stafford if you happen to be in an undergraduate dental hygiene program, direct unsubsidized, or direct plus, also called grad plus. Those are the loans for graduate professional students. If you see the word direct, that means that money came directly from the government, and that debt is eligible to be forgiven with public service. So it's 120 payments with an income plan on direct loans, and then here number three is kind of the kicker, if you will. Every time you make one of those 120 payments on a direct loan, you have to be working full-time for a nonprofit. And folks, they define full-time as 30 hours a week, or full-time as defined by the employer, whichever is higher. So for example, if you are working at a dental clinic and full-time employment, and it's a nonprofit, but full-time employment is 38 hours a week, then you have to be working 38 hours a week. And so a nonprofit would be, you know, the government.org, academic dentistry. Those are examples of nonprofit organizations. By the way, a couple of quick things here. The 120 payments do not have to be consecutive. You can't accelerate the forgiveness of time period. It has to be at least 10 years. Or for example, you know, Dr. Booker, if you worked for 3 years I'm just going to pick on you for a minute. If you worked 3 years at a DIA and were paying back on some student loans that were direct loans, and then you took a job in the private sector, you still have to make payments on your loans, but you're missing door number 3 of these requirements. And so the PSLF clock for you has paused. If you came back to a DIA, now you're working full-time and the clock picks right back up where you started. So the payments don't have to be consecutive, and the employment doesn't have to be consecutive either. So those are the 3 requirements.
Good information to know. So let me ask you about this, and let's talk about this for just a couple of minutes. We've heard a lot in the news about PSLF recently. And sometimes when you listen to what's been going on in the news, it hasn't been too good or too exciting.
Right.
Can you help us determine what is really going on with the program, and perhaps how much of the recent information is news and how much of it is just noise?
Sure. Let's talk first of all about the proposals. And as Dr. Booker said, I've been doing this a long time, and I remember when it passed in the law in 2007, I remember thinking, okay, the folks who are going to benefit the most from this are going to be who? The high debt borrowers, law school, dentistry, medicine, etc. So ever since it was passed, it's had a bit of a bullseye on its back. People have been saying the folks who are going to benefit from this are the folks who are going to be the high wage earners who happen to have the highest debt. So it's always kind of sort of been in the news, and there have been a number of proposals over the years to either limit the forgiveness amount for graduate and professional students or completely eliminate the public service loan forgiveness program. In the past 3 budgets by the administration, the fiscal year 2018, 19, and 20 budget, which was released earlier this year, PSLF was completely eliminated. Now, those budgets were, as some people would say, dead on arrival. They didn't pass. None of the proposals have passed. But this should be encouraging to all of you interested in this program. Even the proposals from the current administration to completely eliminate public service loan forgiveness, they had what I call a carve-out. It's really a trigger date, and they said the following: eliminate the public service loan forgiveness program, but only do it for first-time borrowers. And what they specifically said was for borrowers whose very first loan is dispersed on or after July 1, 2020. Now, folks, again, that budget did not pass. But the good news, I think, Dr. Booker, that the folks can take from this on the webinar is that every time there's been a proposal to eliminate the program, it's always had the carve out that says, leave current borrowers alone. So keep your radar up on that, but when you hear about the proposal or proposals to limit or change the program, look for the phrase for first-time borrowers. So that's kind of piece one of the puzzle. Piece two of the puzzle, and this is where we've had some not good news, but some completely understandable news, is earlier this year, the Department of Education came out with a report that said that 99% of the applications, kind of one of the first wave of applications that came in for public service loan forgiveness, 99% of them were denied. And guys, just do the math in your head. If the program started in 2007, and even though payments don't have to be consecutive, if somebody made 10 consecutive payments, they never had a break in employment, which is kind of sort of unlikely, they could have applied for public service loan forgiveness. The first year they could have done it was in 2017. So here came all these applications, and 99% are denied. And Dr. Booker, you remember this, people kind of went crazy. You know, we told you so, the program's not going to work, et cetera, et cetera. Well, what you're looking at on the screen is a listing of the top 5 reasons why those applications were denied. Now, I'm not defending or excited that 99% were denied, but the reasons make all the sense in the world. First of all, take a look at it. Wrong repayment plan. You had borrowers who were applying to have their debt forgiven who were in a 25-year level time-driven plan. Now, what we don't know is, did nobody tell them that's the wrong plan? Did somebody tell them and they forgot? We have no idea what kind of counseling they got, but they applied to have their debt forgiven because they were working in the nonprofit sector, but they still owed 15 more years of payments. They were in the wrong plan. One of the reasons for doing this webinar is to be sure that anybody listening on this webinar who applies for public service loan forgiveness, that will not happen to you because you know you have to use an income plan. So that's one example. Number 2, missing information. I'm assuming that really means missing information on the application, but look at number 3. You had 16% of borrowers who applied to have debt forgiven that wasn't federal debt from the federal government. Well, of course they had to deny those applications. So as you look at this, the percentage was high, but the reasons are very, very valid. And one thing that I don't know if this will encourage you or not, but hopefully, Dr. Booker, as you said, it will reduce some of the noise about all the denials, is about, maybe 2-3 months ago, I had an interview with NerdWallet, and the guy asked me, he was actually very on top of things, and he asked me about the denials. And I went through the same thing I just went through with you guys. And I said, I anticipate personally that the percentage and the number of borrowers qualifying for forgiveness with PSLF is going to go up over the next couple of years. And the rationale for that is that, number one, Dr. Booker, I think the counseling has gotten much better. Borrowers such as those of you who are on the webinar, you now know more about the program and how to qualify. So that's certainly going to help. The other thing that's obviously going to help is since the government started making all the loans in the 2010-11 academic year, all your borrowing in dental hygiene programs in dental school are loans directly from the federal government. So the percentage kind of sort of has to go up. And what is encouraging to me about that is after the interview, or before the guy, we finished the interview, the guy said he had actually talked to the Department of Education, Federal Student Aid, they call it FSA, and the Department of Ed had said the same thing, that they anticipate the number and percentage going up over the next few years. So pay attention to what's going on. You need to have seen articles like that, but don't panic. Right now, none of the proposals have gone through to eliminate the program. The Department of Defense is actually lobbying the administration to keep the program because they're using it as a recruitment tool. So Dr. Booker, kind of sort of in a way, the pendulum may have swung back toward we really need to preserve this program.
Well, sounds good. Okay. So another question. If you have a graduate who's married and they eventually qualify for PSLF, does the forgiveness also apply to the spouse's loan?
Yeah, that's one of those thanks for playing, but you lose. No, it's just for the borrower only. The borrower has to make those payments and the borrower's debt's forgiven. Certainly their spouse, if their spouse has federal student loans, direct loans, they can meet those same requirements. But just because one borrower gets the debt forgiven, that doesn't apply to their spouse. Good question, but that doesn't work that way.
Okay. So tell me a little bit more about dental and dental hygiene students and how they can keep up what is really going on in the program. You know, a lot of things change and a lot of news is out there. So what is it that you can share with them of how they can stay on top of everything?
A great question. The first thing I'm going to do is with the slide you're looking at now, I'm actually going to start down there at the bottom. The financial aid officers are hugely important, and I'll get to that in a moment. But the older I get, guys, the crankier I get, and I'm not a social media kind of guy. I would just encourage you, be very careful what you read on social media about this program. I think if nothing else, in the previous couple of slides, we kind of debunked some of the rumors that are running around rampant about this program. So kind of watch what you see on social media. Always check with your financial aid office. As a dental hygiene graduate, your financial aid officer is probably going to be on a main campus somewhere, but check with them about public service loan forgiveness. At dental schools, your financial aid office may be a standalone office, or you may have a designee in your dental school who does financial aid for dental school students. The financial aid may also be handled on a main campus aid office, but check with your financial aid office. ADIA has tons of resources on this, including information on the site about how to enroll, how the program works, the slides we just went through, a short little module on this. And so at adia.org, you can find that information. And you can also find information at adia.org/GoDental, who's sponsoring this webinar with the Public Health Service. If you want detailed information, kind of a really good comprehensive Q&A that covers things like, Dr. Booker, the different plans that are available and how to enroll in the program, you can go to the site you see there, the studentaid.ed.gov/public service website. So tons of places to get information. Just, guys, please don't panic when you see stuff on social media that just, is not accurate and is just not right.
Yeah. Along with that, can you share with us how dental and dental hygiene students can estimate how much debt could be forgiven under PSLF?
Yeah, this is a great question, and this is a time to just unabashedly plug one of the coolest things as a dental student, whether you're in the dental hygiene program or a dental student, as current students you can use, and it's called the AAMC ADIA Dental Loan Organizer and Calculator. We refer to it as DLOC. It's available at adia.org/DLOC, and again, this is for current dental and dental hygiene students. The cool thing about this calculator, there are lots of calculators available on the federal site, on your loan servicer's website. The cool thing about this calculator is it lets you upload your federal student loan record right into the calculator, and then it asks you a series of questions about your career plans. And if you're watching this and you are a dental student in the 4-year, maybe DMD or DDS program, this is where it really shines, because it will ask you, are you planning to do advanced dental education? And are you going to do it in an academic setting, or are you going to do advanced dental education in a residency-based program where you're actually an employee of the teaching hospital, maybe, Dr. Booker, a GPR for 1 year, or pediatric residency at a hospital for a couple of years. And it lets you go in and kind of sort of play, if you will, where you go in, put your debt in, put estimated stipend and salaries, and the DLOC has some information from the ADA on dental salaries. We have information in there on stipends, and it lets you customize repayment under all the different repayment plans. But with regard to public service loan forgiveness, it will automatically calculate for you. You don't even have to choose this. It'll show it on a table. It will show you what you would pay on your student loan debt with any income plan you choose over a 10-year period of time, what you would pay out of pocket, those 120 payments we talked about, and how much debt would be left after those 120 payments to be forgiven tax-free. And I think for some of you at the higher debt levels, you'll see some pretty remarkable numbers. So the AAMC ADIA Dental Loan Organizer and Calculator, it's just a terrific place, a terrific debt management tool to help you as a currently enrolled student. And Dr. Booker, I know you're a big fan of it as well. I mean, we've had it for, 5 or 6 years now?
Yes, we have. One thing I'd like to add about that for our listeners regarding the AAMC ADIA Dental Loan Organizer and Calculator, it's available to you as a student now. So if you're not using it, you don't have to wait to see if you qualify for PSLF. You can start playing around now with your borrowing. It is available to all currently enrolled students. There's no cost to you to participate and to use the dental loan organizing calculator, and it becomes a great tool. We encourage you to use it, make copies of the information you get, and sit down and talk with your financial aid advisor about what you're seeing and ask them to help you manage your borrowing and looking at your loans and different things that you can do with it. So it's a great tool.
Can I forget, how many years do they have it free? Is it 7 they have it?
They have it for 7 years. So from the time you start using it, you have access to it for free for up to 7 years.
Right.
Okay, so finally, any final tips that you want to provide to our students on determining if PSLF is a part or should be a part of their overall repayment strategy?
All right, good question as we kind of wrap this up. First of all, this is going to give me a chance to preach at you guys a little bit. One of the things that we have on the Go Dental site under Money Matters in the Cost of Attendance section, we talk with you about how to determine the cost of attendance at your dental school, whether it's dental hygiene or the 4-year program. And we encourage you to never, ever, ever borrow more than you really need. Now, you're limited with how much you can borrow based on the cost of attendance or the financial aid budget every single year at your dental school. But when you see that budgeted amount from your aid office, if you don't need that much money, folks, for goodness sakes, don't borrow more than you need under the premise that, oh, well, I'll have it forgiven later. That just doesn't make any common sense. Plan to pay back what you borrow. But what we want you to do is we want you to know that there is a very valid way for you to have your debt retired if you are considering a career in the government, in academic dentistry, in a nonprofit community-based dental clinic of some kind. Don't not do that kind of work that you really want to do because you're afraid you're not going to be able to pay your debt back. So work with your financial aid officer very carefully to never borrow more than you need. Use DLOC to every single year, go in and be sure your additional borrowing every year is uploaded and that you add in prospective borrowing every single year and run the numbers to see what the potential forgiveness amount could be with the Public Service Loan Forgiveness Program. One of the things we found on the recent class of 2018 senior survey, there weren't a lot of seniors who indicated an interest in the program, and we honestly don't know if when they did that survey, I think Dr. Booker, we weren't sure if they'd had their exit interview yet or what kind of information they'd had about the program. But folks, hopefully with this webinar and hopefully some encouraging information, you know that you can do in dentistry what you want to do in dentistry, and you will be able to handle your debt. And if that includes a career in the public sector, there's a plan of the Public Service Loan Forgiveness Program that just might help you do that.
Great. Well, I want to say thank you so much to Paul, Mr. Gerard, for helping us to get a better understanding of how the PSLF program can help students manage their loans after graduating. We're now open for some questions, and we do have a couple that have come through already. One of the questions we've had, which was, how can you get a recording to review this later? This recording will be published on the Adiago Dental website within about 3 to 4 days after this presentation. So you can go to the Adiago Dental website under our blog post, and you should be able to find the recording there. Okay, so one of the questions, Paul, was, if you're married, is it recommended to file taxes married but separately or jointly to take full advantage of the repayment plans?
That's great. What a question. How long have we got? I'll try and keep this as short as I can. The first thing I will say is, on the adia.org site, if you go to adia.org, you'll see something that we call the red ribbon, and you'll see something that says information for current students and residents. If you click on that, you will see a section that says educational debt management for dental students and educational debt management for dental hygiene students. We're very pleased that on the dental site, and it's open to dental hygiene as well, there is a relatively new module. You don't have to look at me like today, but you'll hear my voice and you'll see some slides. And it's about an 8 to 10 minute repayment module specifically on married borrowers, where we get into the nuances of filing jointly versus separately, which I'm going to briefly address in a moment. There's also a repayment module on pay versus repay that will help you as well. So here's kind of the short, quick answer. under all of the income plans, the much older IBR, income-based repayment, the pay-as-you-earn, known as pay, some folks say payee, I just say pay, and the newer version, revised pay-as-you-earn, known as repay. Every one of those plans, if you're married filing jointly, spousal income is going to be counted in the calculation of your payment. Now, if your spouse also has federal student loan debt, that's factored into the equation as well. Now, it's not a dollar for dollar trade-off. For example, if you're married filing jointly and your spouse makes $100,000 a year and they have $100,000 in federal student loan debt, it's not a wash. But we do want you to know that the federal government recognizes that fair is fair. If you're going to count spousal income when determining the monthly payment calculation, you should at least factor in the fact that they've got some federal student loan debt. So here's what we would encourage you to do. There's no pat answer to this. There is a calculator on the federal government site. We reference it in the modules I just mentioned. It's called the repayment estimator. Some of you have seen it. You can very easily go in and calculate the difference in your monthly payment under married filing jointly and married filing separately. Because listen very carefully. I just said that every income plan will count spousal income if you're filing jointly. But there are two plans, the much older IBR, which very few borrowers are using, and pay-as-you-earn, known as pay, where, guys, if you're married and you file separately, the calculation will only include your income, not your spouse's. And you also get to count two in family size with your spouse as well. So there's not a pat answer to it. What we would encourage you to do is don't assume right out of the gate, and Dr. Booker, I think you know this, a lot of borrowers tend to do this who are married. Oh, I'm married or I'm getting married, I'm going to have to file separately to get my spouse's income off of this. Not necessarily. Go in on the calculator and see what the difference is between married filing jointly and married filing separately. The last thing I'll say to this is we don't profess to be tax experts at all, so don't take that away from this webinar. But if you're married or thinking about it, and you're thinking about filing a separate return, the calculator will show you the impact on your monthly payment. But for goodness sakes, talk to a tax professional who can share with you what you and your spouse are going to give up financially by filing a separate return, because there are reasons married borrowers file jointly. Great question, and Dr. Booker, as you know, we get that all the time.
Yes. Okay, here's the next question. The person says, I am an advisor today, but I am actually in the PSLF program myself. I have made about 5 years of payment. Every year I send in my employer certification, and I am on an income-based plan. Is there any chance that someone in the program could be kicked out if the program's in? I guess I'm just looking for some affirmation that I should not worry as long as I keep making my payments and keep my job.
That's great, and we're glad you asked that question, because one of the slides I didn't put up and maybe should have is about the employment certification form, which I'll get to. But the basic question of you're 5 years in, any chance the rug could be pulled out from under you? There are no guarantees, and Dr. Booker and I talked about this ahead of time. There's no way on this webinar we would say we can honestly promise you that there's not a single chance in the world the program would be pulled and you'd be impacted. But go back to what I said earlier. First of all, none of the proposals have gone anywhere. And the proposals that have targeted the complete elimination of the program, the way we like to call it sunset the program and get rid of it, is they do it by not letting anybody new in it. So for example, you're 5 years in, whoever asked this question, as long as you keep doing what you're doing, you're considered, for lack of better terms, an old borrower. And if the program was eliminated, and it's likely that there would be a carve-out that says for first-time borrowers only, you would be what we call, and I'm still not sure, Dr. Berger, where this word came from, grandfathered into the current provisions, and you would not be impacted. That's the current thinking by many folks in Washington, especially when you consider you already have borrowers who are qualifying, and you have more that are going to be qualifying in the next few years. So great question. The second part of that is the employment certification form, and we get into this on the modules at adia.org that I mentioned under the red ribbon section, and there's one on public service loan forgiveness to take a look at. Be clear on this. You don't apply for the public service loan forgiveness program until you've made all 120 payments. Now, I'm willing to bet you'll run into some folks who say, oh, I applied for public service. What they really mean is they enrolled in the program. And the way you enroll in the program is you do what's called the employment certification form. Folks, remember the 3 requirements. In fact, I'm going to go back and see if I can find them here. Yep, there they are right there. Okay, look at that last one. You have to be working full-time for an eligible employer. Okay, the employment certification form, which is available on the federal government site, this is a document that you complete and you give to your employer. And the form, after it's signed, the form is mailed to an organization called Fed Loan Servicing. Now, this gets a little weedy, but it's a great question you asked. Fed Loan Servicing is the only designated loan servicer by the federal government to do 2 extremely important things for borrowers interested in public service. When they get that document, that triggers them to do 2 things. Number 1, they will go to the employer listed on that form, and they'll verify that that employer is in fact an eligible nonprofit. You may know where you're working as a nonprofit. You want the government to tell you that in writing. So that's the first thing they'll do with that employment certification form. But the second thing they do is that triggers them, Fed Loan Servicing, to track your payments toward public service loan forgiveness. And the borrower or the participant who asked this question, hopefully, clearly you've been doing this, every year Fed Loan Servicing will send you an annual statement that says, to date, you've made X number of payments, you have this many more left. I'm assuming if you've been in the program for 5 years, you probably have an annual statement from Fed Loan Servicing that says you've made 60 payments or close to that, and you've got 60 more to go. So highly unlikely changes would impact current borrowers, and especially current borrowers in repayment. And the employment certification form is how you can track payments so that, go back to that slide right there, when you apply for public service, you know you're not going to be denied because they've been tracking payments for you for all 10 years. Great question.
Okay, so here's the next one. We'll take a couple of more. It says, can you do both PSLF and HRSA, or the HRSA loan forgiveness, at the same time?
Yeah, the HRSA loan forgiveness, a couple of things here. If your PSLF is not mutually exclusive with some of the other forgiveness programs. Now, loans such as, I don't know if this is a loan this person might have, you may hear of borrowers who have what are called primary care loans. Primary care loans are not available, I don't believe, for dental students, and those loans are not eligible. That's a separate requirement. If you've got some loans maybe from a state or something that have particular provisions attached to them, those are not eligible for the Public Service Loan Forgiveness Program. But programs like the National Health Service Corps, that's a program, they don't forgive your debt, but in exchange for service, they send you money every year for you to pay down on your debt. That is not something that conflicts with the Public Service Loan Forgiveness Program. Dr. Booker, as you may know, we've had some students who've had some significantly high debt who participate in programs like the National Health Service, like the Indian Health Service, and they get dollars to help reduce their debt. They're already working in the public sector, so they're also qualifying for public service loan forgiveness. Clearly, if they're getting that additional help, they're not going to have as much debt to forgive with public service, but those things are not mutually exclusive. Great question.
Okay. As a new dental student, do I apply for PSLF now, or do I need to wait until I graduate and have borrowed all my loans?
Great question. And again, just remember, you don't apply for public service loan forgiveness until you've made all of your payments. So to a first-year dental student, we try to make you aware of this program. You can't really do anything or even enroll in the program until you enter repayment. So your steps would be, interesting question, Dr. Booker. As a first-year student, step number 1 for PSLF, don't borrow more than you need. Watch what you're borrowing, because it's early on. You don't know what kind of career you're going to have. But when you graduate, start making payments with an income plan while you're working for a nonprofit, and that's when you would enroll in public service loan forgiveness, when you're making your very first payment, and then you apply after your 120th payment. So to a first-year dental student, you're actually 14 years at least away from actually applying for public service. Great question.
Okay, if you don't work for a public sector, how does PSLF program apply? Can I still have my loan forgiven?
The question is, again, if you're not in public service but you're using one of these income plans, can your debt still be forgiven? It can, and here's where you've got to be a little careful. There's also a primer on this, a module on the adia.org site, but here's how it works. When your loans come due, remember you're going to be looking at a variety of different repayment options, time plans and income plans. If your debt is so high and you have a pretty big gap between your debt and your income, a plan like a standard 10-year plan or a 25-year level plan, those just may not be affordable for you. So you go into an income plan. IBR, probably not, older plan, pay as you earn, or repay that has the 25-year term on it. Here's how these plans work. Let's use repay. It's the newest one. We'll use it as an example. Folks, repay has a 25-year term on it for graduate professional students. What does that mean? That simply means if you use repay, you have 25 years to retire the debt. Now listen carefully. With an income plan, I hope you've heard this, but with an income plan, your payment changes every year. If you're in a time plan, your payment's the same every year. It's just based on the time period. But if you use an income plan, you renew it every year, and your payment changes based on your income and your family size. So if you get into an income plan like repay, nobody has a clue, are you going to need all 25 years to retire the debt or not? One of three things is going to happen if you get in an income plan. Again, we're using repay as an example. Number one, your debt would be forgiven after 10 years if you were working in the public sector. In this borrower's question, they're not working in the public sector. That leads to number two. If you're not going to have your debt retired with public service, you've got 25 years yourself to pay that debt down before you hit the end of the 25th year. Because here's where the forgiveness kicks in. If you're in repay, and by the way, it's 20 years for pay as you earn, but if you're in 25-year term with repay and it's not forgiven with public service and your debt was so high that you couldn't retire it by year 25, the government will retire it for you. They will forgive the debt at the end of 25 years. And Dr. Booker, as you know, that has absolutely nothing to do with where the borrower has been working. It could most certainly be private sector. Here's the big difference, and here's what to be careful about. Unlike the debt forgiven in the Public Service Loan Forgiveness Program, which is not considered taxable income, the forgiveness amount at the end of the term, 25 years with repay, 20 with pay as you earn, is considered taxable income. Huge difference. And so there's a motivation, if you will, if you're not doing public service, to at some point, I think, be aggressive and try to get after that debt and retire it by the end of the term. It's going to be forgiven, but it's going to be claimed as taxable income. And Dr. Booker, you and I have talked about this before. One of the challenges we have is these programs, these income plan programs, they take so long for somebody to go through them. There's no precedent yet for what those taxation rates look like. IBR didn't start until 2009. It's a 25-year term. It's going to be 2034 before anybody hits term forgiveness. Repay didn't start until 2015. Add 25 years to that, it's going to be 2040 before we know borrowers are qualifying for forgiveness and what the taxation looks like. So great question, very good question. I hope that helps a little bit.
Okay, and we'll take this one and probably one more. I was told by the dental director at a FQHC that they do repayment as every 2 years of service. They offer $50,000 untaxed student loans. Is this similar or different than PSLF?
Great question, and kind of a simple answer. Don't confuse a forgiveness program with a loan repayment program. In a forgiveness program, public service loan forgiveness, you've borrowed money from the federal government. If you work in the public sector for 10 years and meet those eligibility requirements, they forgive the debt. Nobody pays the outstanding balance for you. The lender, the federal government, they just forgive it. The debt is gone. They waive that debt. That's different than the National Health Service Corps, who gives you that money every year. They give it to you. I think it's in August. They make one payment to you in August, and you have to sign a statement that you're going to use that to pay down on your student loans. They're not forgiving anything because they didn't make the loan to you. They're just giving you money in exchange for service to help you pay down the debt. So there's a big difference between a forgiveness program and what we call a loan repayment program or a service commitment program like the National Health Service Corps, the Armed Forces, Indian Health Service, NIH, et cetera. Great question.
Okay, last question. What happens if you want to pay more than your monthly minimum on an income-based repayment plan? How does those payments count?
Okay, good question. And I can't believe these words are going to come out of my mouth because I'm old and cranky and I was taught that, if you have debt, try to pay off the debt. Clearly, while the Public Service Loan Forgiveness Program is part of your repayment strategy, the common wisdom is that you would never overpay on your income plan. Why would you pay more than the required minimum amount if the government's going to pick the debt up in 10 years after 10 years of payment tax-free? Now, I have to add to that, you really need to reevaluate your strategy every single year. I hope that's clear. We're not encouraging you not to overpay on your debt, but while public service loan forgiveness is on the table, that just does not make a lot of sense. So that's kind of part one of the puzzle. Again, very important that you review this all the time. The second part of the puzzle is under any repayment plan, including an income plan, the way the loan servicer applies your payments, let's suppose your payment on an income plan is $500 a month. And let's suppose you have 4 direct unsubsidized loans and 4 Grad Plus loans. You've got 8 loans. They're all serviced by the same loan servicer. Let's just use Great Lakes as an example. When you make your one payment of $500, you haven't consolidated, you still have 8 loans. What Great Lakes does is Great Lakes applies part of that $500 on each of those 8 loans. And the way they do it is they prorate it based on how much you borrowed and what the rate was. So if you're paying $500, it might be $60 on one loan, $45 on another, $70 on another, etc. But if you overpay, you actually do it online yourself, and you can target the additional payment on the most expensive loan. That is a terrific and very popular way to aggressively pay down your debt. The first payment, you don't have control over how that's applied, and it goes to interest first as well. But if you go in and overpay, you get to pick the loan it goes on. But again, you wouldn't be overpaying if public service is on the table. Great question.
Great.
We get that all the time, as you know. You're laughing as I'm saying don't overpay. I hate to say that.
Well, these have truly been some great questions and some real interesting information from our attendees. I would like to thank you and everyone for your active participation, especially again to Paul, our Senior Loan for Advisor here with ADIA, Senior Loan for Financial Aid with ADIA. Sharing your advice, your experience, and your knowledge with everyone has truly been remarkable, and I think we all can say we've gained a lot today, especially around the PSLF. Be sure to check the ADIA Go Dental website at ADIA Go Dental often for more events and activities. And remember, our next public health webinar series will be coming in October. Thank you and have a good day and enjoy the rest of your time. Bye-bye.